Hormone replacement therapy after endometriosis surgery can be challenging to navigate because we know that estrogen feeds endometriosis. So if there is any leftover endometriosis, or if there is going to be some endometriosis that will appear after surgery, an unopposed estrogen could make things worse, at least theoretically. That's why for patients who've had severe endometriosis, even when they've had hysterectomy, my practice is to advise a combined HRT. And that in some situations can be confusing, particularly for GPs, because normally they would not use progesterone if the uterus has been removed. So that's the reason behind advising combined HRT in women with previous significant endometriosis, even when the uterus has been removed.